Good morning, students. Actually, we are going to discuss about opioid analgesics. You are going to write about opioid analgesics. You should recollect this diagram and you should draw this diagram for the mechanism of action of opioid analgesics. In the last classes, we were discussing about the NSAIDs. What are NSAIDs? NSAIDs are non-steroidal anti-inflammatory drugs, and regarding opioid analgesics, before going into opioid analgesics, let's recollect what is an analgesic, for what purpose we are taking an analgesic, and what are the various types of analgesic. Just we can have an introduction, then we can go into our topic, that is opioid analgesic. What is an analgesic? Analgesic is a drug which relieves the pain, and the drug will be relieving pain by acting on the CNS or on peripheral pain mechanism without affecting the consciousness, without altering the consciousness. While studying NSAIDs, we have studied it will be acting by peripheral pain mechanism, whereas the opioids will be acting by the central mechanisms. In both the categories, there won't be any loss of consciousness. Then what is a pain? Have you ever experienced pain? I hope everyone have experienced different types of pain. And pain is in one way it is protective in nature. Okay, pain is protective in nature in the sense sometimes we may have some problem in our internal organs, and that will be expressed as a simple like pain. In that condition, if you are taking an analgesic like opioid analgesic, it will be suppress the pain, and that existing disease will get exaggerated. In that cases, you should not take a painkiller. You should know what's the reason for the pain, and you have to treat it accordingly. And whenever you are having a pain, you should analyze what type of pain it is and what's the purpose of taking the drugs and all. So what is a pain? Pain is a warning signal. It is protective in nature, but it will be producing discomfort and suffering. It will be unbearable. The pain, sometimes the pain we are having, it will be an unbearable pain. And whenever you are having a severe pain, what you will be doing? We will be going to your physician. And if you are having excessive pain, just imagine we have experienced an excessive pain. In case of excessive pain, there will be sinking sensation. You won't be able to do anything. Apprehension, a fear will be there, sweating, nausea, palpitation, fall or rise in BP, and tachypnea. These are the various symptoms associated with excessive pain. Why I am telling all these things under opioid analgesics are under actually in excessive pain, in severe pain we will be using this opioid analgesics, whereas in case of mild pain we will be using NSAIDs. And this analgesics will be relieving the pain without affecting the cause, without removing the cause. It will be relieving the pain, and we can use this as an adjuvant to the other drugs to remove the pain. Okay, and coming to the classification, we have opioid, narcotic or morphine like analgesics. Next is NSAIDs, non-opioid, non-narcotic. Non-narcotic means it is an aspirin like analgesic. Opioid means it is an morphine like analgesic, whereas if it is NSAIDs, it is a aspirin like analgesic. Also we have adjuvant analgesics like anticonvulsants, gabapentin, pregabalin, carbamazepine, lamotrigine, and antidepressants like amitriptyline and duloxetine. These drugs are adjuvant analgesics, means these are useful in peripheral neuropathic pain. In neuralgias, we can't prefer this NSAIDs and all. In case of neuropathic pain, we will be using this adjuvant analgesics, that is gabapentin, pregabalin, carbamazepine, lamotrigine, antidepressants like amitriptyline and duloxetine. Okay. And coming to the opioid analgesics, what are opioid analgesics? Opioid analgesics are morphine-like drugs which produce the effect by interacting with the opioid receptors. What are opioid analgesics? Opioid analgesics are morphine-like drugs. They will be reducing the pain by interacting with the opioid receptor. We have opioid receptors, that is mu, kappa and delta receptors. So these opioid drugs will be producing their effect by interacting with the opioid receptors. Coming to the classification of opioid analgesics, we have natural opium alkaloids, semi-synthetic opioids, and synthetic opioids. Okay. First is the natural opium alkaloids. The natural opium alkaloids are morphine and codeine. We know morphine is obtained from opium poppy. Then codeine. These are the natural opium alkaloids. Next is the semi-synthetic. Under semi-synthetic we have diacetyl morphine, falcodeine, and ethyl morphine. Which are the semi-synthetic opioids? Diacetyl morphine, falcodeine, and ethyl morphine. Next is synthetic. Synthetic drugs are pethidine, methadone, fentanyl, ramifentanil, tramadol, and tapentadol. Which are the synthetic drugs? Synthetic drugs are pethidine, methadone, fentanyl, ramifentanil, tramadol, and tapentadol. Next is the complex action opioids. Complex action opioids, in the sense the drugs will be having agonist and antagonist action. They will be having agonist at some receptors and antagonist at some other receptors. The agonist antagonist are nalorphine, pentazocine, butorphanol, and albufin. Which are the agonist antagonist? Nalorphine, pentazocine, butorphanol, and albufin. Whereas the partial mu agonist, whereas kappa antagonist. This is kappa, okay. Partial mu agonist and kappa antagonist is buprenorphine. So if you are asked to write about the classification, you write both the classifications. That is this natural opium alkaloid, semi-synthetic and synthetic, and also this complex action opioids. Coming next to the molecular mechanism of action of opioids. While already I have explained you, morphine and opioids will be exerting their action by interacting with opioid receptors. Okay, these opioid receptors are present in the neurons in CNS and in the peripheral tissues. There are three opioid receptors, mu, kappa, and delta. So yes, morphine and other opioids will produce their effect by interacting with the opioid receptors, which are present in the neurons in CNS and also in the peripheral tissues, and produce effects like analgesia, euphoria, and respiratory depression. The main effects of opioids are analgesia, euphoria, and respiratory depression. Are you clear? Morphine and other opioids produce their effect by interacting with opioid receptors, mu, kappa, and delta, which are present in the CNS and in the peripheral tissues, and produce effects like analgesia, euphoria, and respiratory depression. Now let's see what are this type of receptor. This mu, kappa, and delta opioid receptors are G protein coupled receptors. They are mainly located in the prejunctional neurons. Okay. Next, it will be producing inhibitory modulation. Mainly pain will be inhibited. So, it will be producing a inhibitory modulator by decreasing the release of neurotransmitters, junctional transmitters. It produces inhibitory modulation by decreasing the release of transmitters. The transmitters are monoaminergic transmitters like noradrenaline, dopamine, 5-HT, GABA, glutamate, NMDA, AMPA pathways are involved in the opioid action. Okay, so it will be producing inhibitory modulation by decreasing the release of junctional transmitters. The transmitters involved are monoaminergic, that is noradrenaline, dopamine, 5-HT, GABA, glutamate like NMDA or AMPA pathways. These are involved in the opioid action. Hope you are simultaneously writing the notes. This is what is the molecular mechanism of action. It acts by interacting with the opioid receptors, that is mu, kappa, delta, which are present in the neurons in CNS and in peripheral tissues, and produce effects like analgesia, euphoria, respiratory depression, and all the type of opioid receptors are G protein coupled receptor. They will be producing inhibitory effect by decreasing the release of junctional transmitters like monoaminergic, noradrenaline, dopamine, 5-HT, GABA, glutamate, the glutamate or NMDA, AMPA pathways. Next, what it will do is, whenever opioid receptor is activated, it will be reducing intracellular cyclic AMP formation. Okay, that you will be seeing in the diagram. Whenever this opioid receptor is activated, it will be reducing the cyclic AMP formation in opens potassium channel, or it will be suppressing the voltage gated N-type calcium channel when opioid receptor is activated, what will happen? There will be a reducing in the intracellular cyclic AMP concentration, then opening of potassium channel, and suppression of voltage gate N-type calcium channel. Because of this action, there will be hyperpolarization, and there will be reduced availability of intracellular calcium, and there will be decreased neurotransmitter release by cerebral, spinal, and myelinic neurons. Hope you're clear. We have three type of receptor: mu, kappa, and delta. They are G protein coupled receptors. They are present in the neurons in the brain and CNS and peripheral tissues. They will be producing inhibitory modulation by decreasing the release of transmitters. The mainly transmitters involved are noradrenaline, dopamine, 5-HT, GABA, glutamate. Then activation produces decrease in cyclic AMP, then reduction in suppress the voltage gated N-type calcium channels and opening of potassium channels. Because of this, there will be neuronal hyperpolarization, reduced availability of calcium ion. So there will be neurotransmitter release by cerebral, spinal, and myelinic neurons. Study this mechanism thoroughly. Simultaneously write notes also. Reduces cyclic AMP, opens potassium channel, suppresses N-type calcium channel. There will be neuronal hyperpolarization, reduced availability of intracellular calcium, decreased neurotransmitter release by cerebral, spinal, and myelinic neuron. Hope you're clear. Now we can study the diagram. So this is the structure of a opioid receptor. So you can draw like this. Opioid receptor, it's a G protein coupled receptor. We have receptors like mu, kappa, and delta. In the diagram you can mention the receptors mu, kappa, and delta receptor. And already we have studied, it will be inhibit the release of activation of adenyl cyclase, decrease the release of cyclic AMP. Then it will be inhibiting calcium channels, N-type calcium channels, and it will opens the potassium channel. These things we have studied. So in this diagram you have to represent the G protein coupled receptor. Then you have to draw this calcium channel, that's the N-type calcium channel, and also potassium channel. Here the stored neurotransmitters are there. Okay, now come on, G protein coupled receptor, it activates the GI alpha subunit. Since it activates the GI alpha subunit, it inhibits the activation of adenyl cyclase. Inhibit the activation of adenyl cyclase. The mu delta receptors are involved. It inhibits the activation of adenyl cyclase. So there will be decrease in cyclic AMP, decrease in calcium ion, decreased transmitter release. Okay, inhibit cyclic AMP, inhibit activation of adenyl cyclase, decrease cyclic AMP, decreased calcium ion, so decreased release of transmitter release. Next here also we can put a negative symbol, that is it inhibit the calcium channel. Since it inhibit the N-type calcium channel, calcium entry is reduced. Next it open the potassium channel. Since it opened the potassium channel, there will be hyperpolarization. All these things leads to decreased neurotransmitter release by the cerebral, spinal, and myelinic neurons. So hope you are clear with the mechanism. So today you be thorough with till the mechanism, and pharmacological action I will be giving an outline. Pharmacological action is having action on CNS. In CNS it has depressant action and stimulant action. Depressant actions are analgesia, sedation, subjective effects and euphoria, respiratory center depressed, cough suppression will be there, temperature regulating center will be depressed, and vasomotor center will be depressed. Stimulant actions are at the CTZ, Edinger vestibular nucleus, vagal center, cortical areas, and hippocampal cells. Then it has neuroendocrine effects, peripheral effects like effects in CVS, intracranial tension, GIT, other smooth muscles. So the pharmacological actions and all we can study in detail in the next class. Today you be thorough with what we have discussed previously, like that anti-epileptic drugs, therapeutic classification, selective COX-2 inhibitors, preferential COX-2 inhibitors, and also till the mechanism of action of opioid analgesics. You be thorough. Okay, thank you.